Hi, my name is Brianna Porter and I go to Shaw University, and today I will be doing the pelvis and thigh evaluation. Alright, first off we're going to palpate the location of the dorsal pedis artery, and that's where we're just going to feel right here. Okay, then we're going to palpate the location of the posterior tibial artery. Okay. And then we're gonna perform the capillary refill test. So that's just when you squeeze the big toe, and it should be discolored, and their color should come back. And there you have it. Okay, so next I'm gonna ask the patient to do, we're gonna do the active range of motion for the hip flexion. So I'm just gonna ask the patient to lift her leg up as close as she can to her knee, or lift her knee up as close to her face. Okay. Then we're gonna do the active range of motion for the hip abduction. So I'm going to ask the patient to see if she can stick her leg out to my right, her left. Okay. And then we're going to do adduction. So I'm going to ask the patient just to lift her leg straight up as high as she can. Straight leg. Thank you. And we're just going to see if we can pull that one as close as we can. Okay. Next, we're going to do the active range of motion for the hip internal rotation. So I'm going to ask the patient to lift her leg up 90 degrees. Awesome. And then we're going to do internal, which would be outward. And her hip moved. And we're going to ask to go back 90 degrees. Go back in regular, 90 degrees first. And then we're going to go external, which is inward. And her hip moved again, and we're going to go back to 90. Perfect. Next, we're going to do the Trendelenburg test. So I'm going to ask the patient to stand upright and try and lift her foot up in the back. Can you see if you can lift up your body a little bit? And back down as her hip came down. Okay, next we're going to do the test for the hip flexion. So I'm going to ask the patient to lift her leg up at 90 degrees. Awesome. And I'm going to try and resist it. Sorry for camera quality. There's only two of us. Okay. And then we're going to do the hip abduction. So then I'm also going to ask the patient to have her legs straight up. Bring it down a little bit. And I'm going to ask her to resist. Okay. Then I'm also going to do a deduction. So I'm going to ask the patient to lift her leg up. Awesome. And then we're going to resist. Perfect. Okay, next we're going to do the manual muscle test for the hip internal rotation. So I'm going to ask the patient to lift her knee up at 90 degrees. Perfect. And we're going to do internal and resist. And then we're going to switch and we're going to do external. Nice. Okay, next we're doing the Thomas test. I'm going to ask the patient to lift her knee up to 90 degrees. I'm going to ask her to pull. Okay, do you feel something in your growing? Got the word. You do? Yeah. Okay, so that means you tested positive, which is good. Okay. And then we're going to ask you to go back. And then we're going to do the rectus femoris contractor test. So I'm going to come closer. No. Lay back down.
Oh, sorry.
Yeah. And try and put your foot back up at 90 degrees. And pull. And you see her leg stayed at 90 degrees. Perfect. And then we're going to do the alley test. So that's when you flip over. Nice. And we're going to lift your foot up. Okay. Get up at an angle. You're just going to pull. Okay. Can you lift your other foot up for me? Nice. Cool. Perfect. Okay, next we're going to do the passive range of motion for the hip abduction. I'm going to ask you to lift your leg. This one. I'm just going to hold your back. Can you lift this one up a little bit? Yeah, there you go. Okay. And then we're going to do adduction, so I'm going to ask you to stick this one out.
Say what?
Just stick it out. Okay. Okay, now we're gonna do the hip rotation. So first we're gonna do internal. Perfect. And then we're gonna do external. Do you feel a stretch?
Yes.
Perfect. Okay, and the last two are the anterior impingement tests. So then I'm gonna ask the patient to lift her knee up at 90 degrees. We're just gonna push down. And then we're gonna do the hip scoring test. So then I'm gonna do the same thing. Just see if she can resist a little bit. And there you have it.